Jack,
John, how are you?
very good, mate. Today we thought we would talk about something that we find very interesting and has probably become quite sexy in the realm of healthcare and even sports performance. And it's this idea of complexity. Now, it's something that we've probably been discussing for 4, 5, 6+ years. And I think even our knowledge of complexity and what it means in regards to these areas has evolved enormously. I think if we're honest with ourselves at the start, we were probably not using it in the way that it has now evolved our understanding to be able to use. And I know that we've referred to it a lot in some of the discussions that we've had, so we thought it was probably time that we start to talk about some of these concepts in a little bit more depth.
Yeah, and more importantly, talk about how it's relevant to what we do in the real world, because what you alluded to before I think is relevant, and we were laughing about this before, is there's a lot of discussion about the theoretical concepts of what this actually means, but
Yeah, and
its application to the real world still appears to be very limited. And even from like a research perspective, you see that because there's very little research of actually utilizing a complex model for treating problems.
yeah, and I think like one of the things that I think, as I said, it's become sexy to just use the word, oh well, it's it's complex, or complex systems and stuff like that. But I don't know that a lot of people are necessarily explaining what they mean when they say it. And I'm not saying that they don't understand it; they probably do, but they're maybe not going into the depth to assist people to be able to actually create interventions that are useful. So maybe that's kind of where we'll jump off. And I know that for you, one of the key things that you always try and do when you educate, whether it's students, when you're working in your university position, or even with some of the stuff that you try and do with our staff, is talking about what actually is the human, what is the human body, what kind of system is it? And if that's the case, then how do you interact with it? So I don't know how we jump off on this part, but like, I think it's probably easiest actually to ask a couple of questions.
Yeah.
And when you ask someone directly, especially even if it's a healthcare practitioner, what is the human system? What kind of system is it? They often struggle other than saying, well, it's a biological system.
Which is true and relevant.
Yeah. And I think one of the key things that people struggle with is terminology and a lot of utilization of metaphorical language around things like the human body being like a mechanical system.
Yes.
What are some of the limitations to kind of having discussions where you start referring to the human system as, it's like a car that you need to get serviced, or, we're trying to, put a bigger engine into the athlete. What kind of factors does that sort of bring forward in terms of understanding what the human system is?
Well, I mean, there probably is some relevance to some of those analogies, particularly say creating a bigger engine.
Yeah.
I think the big thing to understand is human systems are adaptable as opposed to mechanical systems which are not. And the good thing about that is we can, quote unquote, develop a bigger machine through applying appropriate physical stresses.
And I think that straight away brings forward, there's been a huge concept, particularly in sports performance, and I think it's starting to become more apparent also in healthcare and injury. People talk a lot about injury prevention and injury reduction, and they talk about this idea of robustness or resilience. And I always think that that's a term that I don't know that term is actually the right term.
Why do you say that?
Because, as you said, human systems are adaptable, which means if you use the direct understanding of what robustness is, the definition from the dictionary, what you're looking at is something that can withstand a stressor, but it's not necessarily improved and it's not necessarily damaged by that application of stress.
It just has a neutral response.
Yeah. And the key thing with adaptive systems, which tend to fit into, if you want to go into the terminology of the categorization of unordered or disordered systems, they actually have another response, which is if we talk about the three responses, I think this is one of the key ways to differentiate between ordered and unordered systems.
This is something we've talked about before with hormesis.
Yeah, yeah. But if you have an ordered system, it's something like a mechanical system where the relationships between the way in which it interacts with the world and even with its internal parts is relatively linear. You know that if you do X, you will get Y. In unordered systems, you have non-linear responses, meaning if you do X, you might get Z, you might get B. You don't actually know, and part of the reason for that is the interactions between the parts in that system will often give you responses that you don't expect. Some of them, as we said, can be negative, so that's response one. You apply a stressor, so for instance, you go for a run, that's longer than you've ever done before. The first response might be you actually have pain after that, or you're so fatigued that your performance goes down for the next week. The second response is it's basically neutral. You're not better from the run, you're not worse from the run, and you can get on with your normal training. But the third response, which is what makes unordered systems and non-linearity of these systems valuable, is that they can adapt. And therefore, the third response is that the system actually may improve. And what's cool about that is you might go for a run, and then because you were able to carry out that run, the next few runs that you do, or the consequent runs going forward, are actually better. You have more fitness, or you have more speed, or whatever it is. You actually can achieve more from that outcome for future tasks.
What's interesting about this too is this is something that I think is evident when you look at the literature, because I think one of the things that isn't captured well, or perhaps not highlighted, is the range of response to a particular stimulus. And when you think about research, typically they'll provide averages or means about response to a particular stimulus. And that's useful because it gives you an idea that there is a bit of a signal there that in response to this type of training stimulus, we're going to see on average this particular outcome. But it doesn't give you an indication of the range. And I think that's a really important thing to highlight too, because it highlights straight away that there is complexity in human systems, is that the response and outcome will vary. Because sometimes you're going to have hyper responders, people who actually have a much more significant and hopefully positive response to the stimulus, but you're also going to have non-responders. There's actually a reason for that. I don't think that may not always be captured in the research, because if you even think about your inclusion-exclusion criteria, there may be factors that they don't take into consideration that will separate who does respond and who doesn't respond. But certainly within the real world, we see this all the time. But I think one of the challenges that we have is trying to understand who is going to respond the way that you want them to.
And I think that brings forward one of the more interesting parts of dealing with these kind of systems. And you say that, straight away I think obviously towards sport and my coaching of athletics, and
sure,
you have someone, you apply the same program to the two people and they're in the same events and their performance level is relatively similar. One gets better and one gets worse, or one gets injured. And that straight away makes you start thinking, as you said, what's the difference between who's going to respond positively and who's going to respond negatively, and who's going to have no response or a neutral response?
And that's where I think the challenge lies. And for someone like yourself who's working with the same athlete over a long period of time, you start to understand the patterns that emerge in that individual, because you understand the physical factors, with regards to, say, their training history, their fiber typology, but you also understand all the other factors with regards to, some of the hormetic stress profile, like their sleep, their diet, relationships, like all those factors that have a big impact on particularly their recovery, and therefore how often or frequent you can apply stresses to try and adapt that system.
Yeah.
But the challenge I think can come about, because this is where I think it's important to talk about the real world, is for people who are working with different people all the time, how do we actually start to try and, because the idea of non-linear means that there isn't any causality, but there's obviously
correlations,
of course, and we know that on average, if you apply a particular stimulus, you're going to see a certain effect. But we also know that there's variability in that response.
Yeah, and I think this is what we wanted to get out of this talk was there's been a number of discussions in research. I know in healthcare, there's a couple of papers that came out through the BJSM, Fonseca, Bittencourt. And they introduced these topics exactly kind of how we've been talking about it.
Yeah.
Adaptability, non-linearity, responders, non-responders, understanding that these non-linear responses may mean that you get different outcomes. But no one's really gone to the effort, I think, at this stage. Probably the one who's spoken about it the most in the most practical sense is someone like John Kiley.
True.
So for people who are interested, I would look at some of his work, and he's gone into even more interesting areas that I think we've spoken about briefly before, things like predictive coding and how that the psychological and even the past experiences of that individual will actually change their expectations of what's happening, but also what their prediction might be about their space and how they interact within that space. But one of the things I don't think has been done well, because I think the principles are pretty straightforward.
Yes.
Right? But no one's kind of gone to the effort of going, okay, well, we know that a human probably fits into this category of being adaptable and non-linear, and therefore is likely to be in more of a complex system space. I've got them with this problem, whatever it might be a performance problem, it might be an injury, whatever that may be. How do I then interact with that so that I'm getting the best outcome for that individual at that time, given that adapting nature of their system, rather than I'm going to apply, say, a protocol or, theoretically what the best training program should be. Because every practitioner, every coach will tell you, best laid plans often don't come off.
Yeah, absolutely.
Right? You can plan as much as you like, and then, and I always think of the the Mike Tyson quote, which is, everyone has a plan until they get punched in the face. And the reality is, as a practitioner and as a coach, and everyone in between that sort of gamut, ends up getting punched in the face at some point and realizing, oh wait, I did all this planning and I can basically throw most of it out.
And I think that's where really, why are we actually talking about this? Because again, instead of getting stuck in the theoretical of this idea of complexity, the reason why is because it helps to make a lot of sense of why you see particular behavior or outcomes, or more importantly, variability in the response of individuals you work with. And this is really important, I think, too, because we can follow a protocol and, let's say on average you get a relatively good response. But you're also going to have people who don't respond well. But the other thing you're going to have too is you're going to have people who may respond well, but may be able to respond much more quickly or to a much greater effect if you apply essentially a tailored approach. And I think this isn't, when you say it like that, I think most people go oh, yeah, of course.
Yeah, you want to tailor it to the individual.
And I actually think a lot of clinicians actually do that already. This helps to try and create a foundation of why that is the case.
Yeah.
And I think then from that we need to think about, well, what do we actually do with the body of literature that we have to apply it to the real world? Because I think one of the issues we see, and we've talked about this before, is we need to be careful that we don't fall into this procedural process.
Yeah, we see a research paper.
Exactly.
It worked in a particular population. And rather than, I think the point that you're making is, rather than looking at, okay, what was unique or what was clear about that population that may be applicable to a population that you may see, and therefore that may be your responder group that you can use that literature for.
Absolutely.
Whereas you may need to do a different type of intervention for a group where you identify that they maybe don't fit within that population.
Yes.
So I understand exactly kind of where you're going with this, and I think the thing that we want to start thinking about is, okay, we have a person in front of us. Our job is to kind of probably identify a couple of things. The first is to understand about them. All right?
And what does that mean to you?
Well, I think the big things are, we have to start identifying, okay, what characteristics do they have, right, that are related to what they need to be able to do. So we've spoken a lot in some of the education stuff that we've done about doing, a needs analysis. And when we do a needs analysis, it's a needs analysis of the problem, right? So you've got to identify, okay, I want to go back and play soccer. All right, and they want to play in this particular position, might be midfielder, goalkeeper, whatever it is. So you've got to identify what actually is the criteria that they need to be able to meet? And there's lots of literature often on these tasks. It could be something simple as I need to get up out of a chair, right? So if you're working with someone who's at that level, that's okay too.
Of course.
The thing that you got to identify, okay, what's the problem task? Okay, they're struggling to get up and down out of a chair. This one might be, as a goalkeeper, they're struggling to be able to do lots of plyometric jumping, during the activity of goalkeeping. What are my requirements? So you go through the process of working out what are the physical, psychological. We often have spoken about the 4 pillars that gets used in sports performance.
Yes.
Ideas of they usually fall into 4 categories: physical pillar, the tactical pillar, the technical pillar, and the last one is psychosocial, emotional pillar. All right. So what do you actually need? What are the things that person actually needs to be able to carry out that task? Then you go over and identify that person and you say, okay, where do they measure up on all of those things? And I think we're really good, particularly in physio, but also in, say, exercise science or sports science or strength and conditioning, going and looking at all the physical factors.
Yes.
Right? But we probably haven't necessarily looked at the tactical, the technical, or the psycho-emotional or social factors that are going to be needed.
We probably need to actually, I think we should expand on that too of, I don't know what category you put it into, but other systemic factors in general related to someone's...
Yeah, well, they're in the physiological,
Yeah.
Looking at things like general health. And we've spoken a lot about the concept of, say, hormetic profile.
Yes.
I think we have defined it in this podcast before, but that idea of hormesis is, how you deal with the application of stress, right? Now, it has, in its origins, it actually goes back to toxicology, hormesis. It's, basically the process by which you can increase the amount of stress that you can undertake. And previously it was in taking, like medications or poison even, and being able to deal with increasing amounts of that by slowly exposing yourself to that stress. But we talk about it from the concept of, okay, what is this person's stress profile or hormetic profile? And what we mean by that is, how much stress have they previously been exposed to, both negative and positive? And what does that mean for their current status to be able to deal with stress?
Yes.
What's their capability when it comes to being exposed to new stresses because of things like their age? So if we ask a simple question, would you expect a teenager or someone who's 85 to be able to deal with uptake of a new activity? Which one do you think has more capability to adapt to that new stress? Most people, I think, will very quickly identify, okay, the teenager probably has more, what we would call adaptive capacity or adaptive reserve.
Absolutely.
Right? And there's lots of physiological reasons for that, which we probably won't get into today, but we understand that. So straight away, you're starting to put together, this profile. So someone walks in, you say, okay, what task do they need? Work that out of those 4 pillars. And then you start looking at that individual and you go, okay, well, one, what exposure have they had to, say, that physical stress before? Do they have the psychological and emotional skills to deal with that? Do they understand the task and can they carry it out from a technical standpoint? Do they understand the game, the rules, all those things, the game plan from a tactical standpoint? And then you've got to start looking at factors around like, okay, are they an age that's appropriate for them to do this because they need to be able to adapt to it? What are factors relating, as you said, to things like general health? And are they doing things that are supportive for them being, able to carry that out? Because if they're not, you're in a position where you might have these plans, but as you said, you're going to get a non-response or a negative response or a neutral response because they actually don't even recover from the stress that you apply.
Yeah, and what you're describing there, I think, is we need to start more at a macro level of understanding all these factors that we know from the literature that are influential to someone's physical capacity and their sensory motor output. And then over time, we can start to look at it more at a micro and individual level because we identify these large factors, but then we can also start to get down into the weeds of understanding what is this individual's phenotype, for instance, when you think about, say, typology and how they're going to respond to a particular stimulus.
For people who are sitting and going, okay, you're talking at a higher macro level, it's as simple as, would you give someone who wins, the state cross country every year a program that only does very, very high intensity work? Probably not, because as you said, their typology and their general phenotype is one in which they respond to endurance training.
Yeah, absolutely.
And that's what they're good at expressing. So and people, I remember we were talking to some of our staff about this, and they're like, well, how do you even work this stuff out? And to be honest, it's actually very easy. You just ask questions. You say to someone, what kind of player are you? Are you someone who's short, sharp bursts and you get tired really quickly, but you're very fast or agile or powerful? And they might say, yeah, that's me. Or they might say, no, I'm like the diesel engine. I'm slow, but I can go all day. And as soon as you hear that, it's like you might need to go through further testing to kind of confirm that.
Of course.
But people are pretty intuitive about what they can and can't do and what their kind of output is.
Yeah, and look, what all this describes is changing your thinking as a clinician or a coach or whatever it may be. It's not just thinking about what's going on, but why is going on and how. Because I think particularly in a sports medicine perspective, we obviously need to have certain skill sets, and we can be very methodical about trying to identify what the injury is. A hamstring strain, a stress fracture, whatever it may be. And we need to be very methodical about that process to understand the specific pathology and whether or not that needs specific management from a medical, surgical perspective, or even like titrating their load. But then we also we are always going to end up in the same thinking process of, well, why has this person got an injury in the first place? Because the reality is not everyone gets an injury, and there are reasons and factors associated why people do develop problems and why people don't. And this is where this complex thinking helps you to understand, well, what are the factors going on? And more importantly, what are the main factors? Because I think the issue that we can also have is, well, one, we become too procedural of treating someone based on their problem, i.e. their injury, as opposed to understanding... Well,
potentially more about them.
Exactly, yes.
And I think you highlight a really important point. If you look at, say, something like hamstring injuries, the reason that we haven't seen the changes that we would have liked from the work that's been done, say, by the hamstring injury group here in Australia, where they have shown that actually, we can reduce injury risk by the application of eccentric loading, and that if you get to a certain level, you do seem to have some level of protection. Now, to me, if that was the only cause, then we would have seen a huge drop-off. And they talk about this issue of compliance, people don't do it. But there's clearly still a gap. And the reason that there's a gap is there's lots of reasons why someone may strain a hamstring. Absolutely. And that's the complex nature of the injury development. And what you tend to find is sometimes the ones that, or some of the injuries that people think, well, I don't understand why that happened. They had strength, their running technique's reasonably good. We do expose them to, say, high-speed running, all of those things. Why did they develop a hamstring injury? And often it's got to relate to some of those other factors and the dynamic nature of those factors. Yes. So something like part of the general health scheme or their ability to deal with stress in real time. If someone hasn't slept for 3 or 4 nights because of whatever reason, maybe they're stressed out, maybe they broke up with their partner or whatever it is, and then you expose them to a stressor that maybe is the same stressor they've had in the past. We know that things like sleep or even stuff like exam stress will actually reduce their reserve to be able to deal with those stresses. And I think I've spoken about it before, the work of Brian Mann, who showed the injury rates went up in a Division 1 college football team during heavy academic periods.
Yes, yeah. And look, what all this highlights too is, we all find ourselves in situations where you're treating someone following an injury and they're not getting the outcome you want.
Yeah.
And, there are times I know in my career where you go like, what the hell's going on? It almost feels chaotic in the sense that you're like, this doesn't make any sense. The reality is there's always an ability to make sense of the situation. It's just a matter of whether you've identified all the key modulators associated with the problem.
Yeah.
And this is where I think sometimes you see the problem where someone will go, this is too complicated, I need maybe an expert opinion. And look, there are obviously situations where that may be the case, particularly if there's, say, been a misdiagnosis. But more often than not, it's because you haven't identified one of the key modulators associated with this issue. And again, that may not always be physical.
Well, actually, it's funny you say that. to give people a bit of an example, I had someone come in during the week who has been having ongoing, medial tibial stress syndrome, so shin splints, and at times it's shifted into stress reactions. They've had to come in and out of a boot and all of these kind of things. And they were actually referred by someone that is in the sports performance realm that I know, and they said, look, we've identified a lot of these physical things, we feel like we've addressed a lot of them, but I'm still having these problems. They can't get their running going. They want to do some more long distance running. So I said, okay, sent them in, and straight away it was really obvious when I started asking questions around things like nutrition that this individual wasn't eating enough of the food, wasn't eating enough of the right food, had a history of not getting enough nutrients.
Yes.
And straight away that starts setting alarm bells off in my head about bone health.
Yeah, sure.
Right. So one of the first things that I did was, speak to this individual about, okay, do you have a dietitian that you've worked with? And actually got in contact with the dietitian, said, like, I need you to do some review with this person. We need to be making sure that we're getting, one, adequate energy, but they need to be trying to maximize bone health. So whether that's, utilization of vitamin D, calcium, other dairy products, and maximizing, collagen intake, maximizing protein intake, all of these things that are going to be good for lean muscle mass, for the development of bone tissue, and for maintaining their ability, one, from an energy standpoint, particularly carbohydrates, for being able to actually maintain the amount of physical activity that this individual wants to do.
Sure.
And to me, maybe I'm jumping the gun because it's still early, but I think if we get that right, it creates the environment in which the mechanical loading we can do from a physical point of view, both from the sports performance professional and from our physio point of view, to actually get a good result.
Yes.
If you're not maximizing that, you're not going to get a good result, because the environment is not one in which... Actually, it's funny because I was thinking about this recently in some of the education stuff that we're putting together. In terms of tissue, there's two main things that I think are really valuable or important to think about. Is one, are you applying appropriate loading for that tissue to respond in a positive manner? And actually, is there the nutrient environment for which you can maximize that adaptation?
And straight away, what you're highlighting here again is the interaction between different systems in the body. And again, this is probably an obvious thing for most people, where it's like, yeah, well, of course you've got to eat. But yes, you've got to eat, but more importantly...
You've got to eat the right things.
And not to mention, if you actually want to build the appropriate physical capacities through mechanical forces, you also need to then have the appropriate building blocks to be able to get the tissue to respond and most likely, be enhanced in its strength or size in order for that effect to be realized. And it's interesting, I think we've mentioned this before, but there's some good examples to be made here about the complex interaction between, say, diet and mechanical stress. The most classic example is thinking about, particularly in elderly people, of the response they'll have to protein.
Yeah, this is some sort of like Stu Phillips work.
Correct,
and stuff like that. For people interested, Stu Phillips, I think is at McMaster University in Canada. If you're interested, have a look at some of his work. But yeah, keep going, Jack.
Well, yeah, and it's a good example because one thing that's actually quite that's agreed upon is the importance of increased protein intake in elderly people. Part of that is because of the reduced assimilation of nutrients from food as you get older. But more importantly, food alone actually won't lead to the positive benefits you see with the higher protein intake of things like maintaining or improving muscle mass or maintaining and improving skeletal mass if there is no mechanical stress. This relates to a concept called anabolic resistance. So if you just give someone a higher protein intake who's an elderly person, you might not see that positive response until you start applying mechanical load. Because straight away, the tissue's responsiveness to being able to uptake those nutrients will change as you apply mechanical stress. That creates that cellular signal to go, okay, we need to adapt. Let's actually bring in these nutrients now to then be able to create new tissue. And it's interesting too, a lot of, I can't think of his name off the top of my head. He's at the University of Kentucky. Van Vliet is his name, is a Dutch guy. Looked at a similar effect with regards to food and looking at food that's been reduced to a particular nutrient like supplements versus the whole food matrix. And again, you see a difference in the assimilation and the changes in your physiology from eating a whole food as opposed to eating a particular nutrient in isolation. And this again highlights that when you think about taking up nutrients and assimilating that into our physiology, there are so many different cofactors associated with that process. Similar thing for exercise. When you look at some of the work of trying to create, a pill to upregulate a particular cellular pathway.
Well, that's the dream, isn't it? People
Well,
say just take a pill and it fixes everything.
But these are interesting examples of looking at. There's just so many things happening at so many different levels within our physiology, within different systems of the body as well, that we need to be a bit more expansive of thinking of how someone responds to stimulus over time. And I think this is where it's a useful thing to think about is how do we then actually integrate research into clinical practice? Because it's not just a simple verbatim, let's just do the specific method
Well, I think, we started to talk about it before and maybe get into it now, but it is that idea of taking the time to go through particularly methodology and identifying, okay, does the profile of the subjects in this study start to match the profile of the individuals that I'm dealing with?
Yes.
So if you have, say, teenage female volleyball players who have patellar tendinopathy, how appropriate is that for a 60-year-old male who develops patellar tendinopathy playing tennis? Are they the same thing? Can you apply the intervention that they applied for the volleyball players that was successful to that same group?
Yes.
And that's the thing that I think we misinterpret. We see the results and we think that was positive. I want to use that. However, the big thing that we probably need to identify is there enough of a crossover in those tasks? Now, tennis and volleyball, maybe. There is some crossover, so can we apply it? Potentially. Is there a crossover in the physiology of a 16-year-old female volleyball player and a 65-year-old male? That's starting to get a little bit wider. It's not that there isn't crossover, there is, but it's starting to get a little bit wider. One's probably got much more degenerative tissue, less muscle mass, has, hormonal profile is dropping, has probably had many more previous injuries, all of these kind of things. And that might not be the case, but these are kind of the things that you don't know. And so you can't, as you said, take verbatim, they did this intervention for this tendinopathy. This will work in my 65-year-old male who's also got patellar tendinopathy.
And that's going to then change the magnitude of stresses that you're going to be able to apply, the frequency of the stresses you're going to be able to apply, and particularly for an older individual, the importance of identifying some of those non-physical factors, whether that's related to, say, their dietary intake, whether related to sleep or other stresses in their body, in addition to potentially having some comorbidities that's going to influence the
they might be on
turnover.
Medications that changes their ability to exercise and
exactly.
adaptation that they get. So that starts to change, as you said, that whole environment.
And the other important thing to remember too is when we get into the real world, we don't have to worry about controlling everything.
No.
And again, this is
not that we don't have to worry. We can't.
Well, no.
So you have to start thinking about what does that mean.
Exactly. And more importantly, what does it mean when we start to apply multiple interventions at once? And I think this is something that we can't really appreciate at this point because it hasn't been done a lot in the literature where you're like, let's just focus on improving the outcome. Let's apply multiple interventions at once, because do we start to see potentially nonlinear outcomes?
I think this is the biggest thing that allowed me to understand how to deal with complex systems. And it is not thinking about what goes in, it's about thinking about what comes out.
Absolutely.
So we get really concerned in healthcare about what we put in. But actually, it's not to say that what you put in shouldn't be well thought out and well planned and researched and backed by, clinical evidence.
Of course.
And clinical experience. But what comes out is much more important, and that's the signal that you need to measure, not what you put in. And I've had so many conversations with healthcare practitioners or coaches or physios who get so caught up in what they're putting in and going, well, there's really good foundation and basis for why I'm doing this, and it's based on this, and it's based on that, and it's based on that. And it's like, yeah, but the outcome's bad. So who cares how well researched and how much evidence there is for what you're putting in. It doesn't matter. You could, for example, do something that isn't, it's maybe lower on the evidence in terms of the literature and the quality of it, but the outcome that you're getting is fantastic, right?
Yeah.
And what you need to do then is obviously think about amplifying that outcome rather than worrying so much about how well credentialed the input that you're putting in actually is.
Exactly, yeah. I think of some of, say, Nanda Gutra's work,
Yeah.
who's done a lot of research and looking at, say, hamstring strains and injury prevention. And it's interesting because there's one study that he published in the last year or two of looking at changing pelvis mechanics with sprinting. And it's interesting the type of process that they use where, again, it still is protocol driven, but they did a lot of things of trying to build up individual tissue capacities, so doing like different types of resistance training type of work, which included flexibility, strength work and so on. Then also doing running mechanics at the same time and seeing how can we change pelvis mechanics as we, say, build or upgrade certain tissue capacities whilst concurrently getting them to focus on particular mechanics of their running and seeing how that changes when you're doing them together. Because, as you build up those tissue capacities, you're essentially you're giving the system more tools to be able to solve the problem. And what you may see, in fact you see this frequently within the real world, is you see that their ability to create biomechanical changes all of a sudden it changes quite significantly, not just because of the cueing that you're using, obviously there's a coaching element to it, but because their ability to create those particular movement patterns is changed as you improve their flexibility, improve their strength, improve their explosiveness.
Yeah.
And here we start to see that interaction between
We've spoken about this
components
before as well, and I think this is the thing that where you start to put this together, because at the end of this I hope that people kind of start to put the picture together when it comes to human systems or complex systems. When you've identified, if we go right back to what we were talking about, how to deal with a complex problem or a complex individual or both, when you've identified, okay, what are the big drivers of the performance for that task, what are the key drivers for the task that this individual has or doesn't have, and you start to upgrade some of those features within their system, what you're doing is giving them, we'll talk about them as modulators, but some people might talk about them as tools, and we've spoken about this a lot of, like, if you give them more of those important tools in the toolkit for that task, the likelihood that they'll be able to solve that motor task with proficiency is better.
Yes.
And as you're alluding to, and we spoke about this when we spoke about flexibility, for instance, and say distance runners, and we spoke about the concept that a lot of distance runners will get away with poor flexibility. And the reason is for that task, you don't need to have an extreme amount of flexibility, particularly if it's got to do with like lateral movement or things that are not in the sagittal plane. And even for them, for running, right, and particularly slower, like I call it slower running, obviously some of them are moving reasonably fast, but slower running compared to, say, all-out sprinting. The range of motion that you go through is not anywhere near your absolute limit. So for that reason, you don't need to have that extra tool or modulator, a modulator of extreme flexibility through, say, your hips, ankles, knees, whatever it is. However, as we spoke about, if you then put that person with that limited flexibility into a field sport, you may find that all of a sudden they're getting groin pain and hip pain and pelvis pain and knee problems because they don't have that tool in their toolkit to be able to navigate a 360-degree sport that does require more flexibility and more range of motion and more mobility about their joints. So the key that I'm sort of trying to put together for the next piece is, if you've identified the problem and you've identified what features or modulators this individual has, you now have the opportunity to start thinking about what are the features that you want to upgrade within their system so that they have the tools to be able to solve that problem. Yes. And when I say problem, it's, or that task, and that's the emergent behavior we often talk about, is them being able to carry out that task.
Well, and that's probably one other thing that we need to highlight here with regards to complex systems is the ability to self-organize, because the reality is you may start to implement changes in, say, their physical capacity, that may not like directly relate to, say, biomechanics, but you
Exactly.
actually start to see changes
And this-
because of that subconscious reorganization.
Yeah, and this is where we're saying if you give them more of these tools, they will find a way inherently to self-organize that into a solution.
Yeah, absolutely.
Right? Your job is to work out which of the tools that they actually need in that toolkit that are the most important tools. So, as a really dumb analogy, if you've got a task that really needs a drill, if you just give them a screwdriver, it's going to be a lot harder to solve that. They might be able to do it, but it's not going to be the best solution for it.
And the potential for problems to arise is going to be greater.
And that's where it's like, if you keep using a screwdriver to do the role of a drill, eventually a screwdriver will wear out and break. And that's the same thing that happens within the human system. If you have a tool that's inadequate for that solution, it ends up failing at some point.
Yes, absolutely.
Conversely, you'll also have times where they actually don't even have that tool. So the reason that they keep failing is they actually don't have the tool in the toolkit to solve the problem. So again, if we use the analogy of saying a drill or something that needs to screw something in and all they have is a hammer, you're in trouble.
Well, you know what I think is a great example of, like, again, we're talking very theoretical here, but a good example of this is the problems of specialization within adolescence. And this is something that's becoming more and more evident, particularly with more what you would call, say, wicked type sports where there's
it's open environments,
a lot of external perturbations and so on. Where
something like a field sport, where opponents, it's 360 degrees, there's all different weather conditions.
And what we see is for children or adolescents who specialise early within a particular sport, which again, you think about it, particularly as a parent, you might be like, well, my kid's really good at this, I should get them to really
focus on it.
And they might really enjoy it too. It's like, let's just get them to focus on tennis, golf, whatever it is. But if you look at their outcomes with regards to their success at a professional level, in addition to an injury prevalence, we see much higher risk of developing an injury or much lower probability of them becoming successful at a professional level the earlier that they specialise. And so part of that, you have to think of, well, why isn't that? Like, aren't you giving them more time to actually develop and refine their skills?
But you're giving them less tools.
Well, and it's actually that refinement process is part of the issue, because that you're reducing the diversity, particularly during those very important stages of childhood and adolescence where you want to build up diversity in their sensory motor system so that, the easiest analogy to describe it is you actually have a larger toolkit.
Yeah.
And particularly when you think about...
And it's funny, if you use the similar language, sometimes they have the right tools, but the tool is so specialized. So, it's a certain size drill bit.
Yes.
So it works in this situation.
Yes.
But as soon as you take them out of that, it's not an effective tool in that situation. And that's what happens with specialization. You want them to have, a drill that has 5,000 different drill bits that you can put onto it.
Yeah, exactly.
If you've only got 3, you can only solve 3 problems.
Well, and that's why you won't have successful outcomes, particularly in field-based athletes, if they've got an injury and you try to rehabilitate them in a controlled environment like a gym. Now, it's not to say that there isn't a role for that, but the reality is their ability to perform and mitigate injury is out in the field where there are so many unknowns. Like, you think about what happens when you're playing a football, soccer, whatever it is. You're constantly responding and reacting to so many things that create stresses through your body that we can't just simply limit it or refine it down to, all they need is this particular strength, and we get them running at these running speeds, and maybe do a little bit of change of direction, and they'll be ready to go.
And this, I think, goes to the next step. So again, I'm going to keep saying the same things, but essentially, we need to identify what the requirements of the problem are. We need to identify what the current capabilities of that individual are. Then we need to start thinking about, okay, what tools do we need to upgrade based on that evaluation of our needs analysis? The next part is, based on that, what we need to do is start implementing interventions that upgrades those things. And you've alluded to it there. We need to do it with what we call safe to fail experiments.
Yes.
So what we mean by that is it's exposing them to something that it has 2 roles. It has the role of trying to increase their capability in that task, whether it be, say, increasing their strength, or if it's in, say, like a field-based setting, their coordination or the capability of being able to coordinate themselves in a field setting. But the second thing it does is for us as practitioners, it creates error detection where we see what their failure point is. And the reason that we call them safe to fail is we actually want to see where their capability ends for that emergent pattern. We want to see, okay, can they lift that weight, or can they jump this distance, or can they move sideways, or can they pass a ball, or can they understand the play? And we've set the task hard enough that we may actually see where their capability currently lies and where it ends. Right? We don't want to set it so far ahead of where they are that the likelihood is maybe they get injured or their performance is so poor that they're embarrassed to even try it again.
Yes.
We want it to be a safe to fail experiment. And that brings to then the last probable, part that we need to be thinking about before we say rinse and repeat, which is monitoring and closely monitoring what you see. Now, monitoring has become a whole area of, say, sports science in itself, and it's becoming a whole area of health medicine in regards to things like wearables. There's lots of different technology that's really enhancing this, which is great. Our job is to get a good picture and a good way of measuring what we're seeing in our safe to fail experiments to know whether we amplify that intervention, whether we dampen it, whether we keep it the same, right? And what this does, I think, because I know that it's something that we've spoken about a lot, is it gives you the guide of how you make your steps in, say, a rehabilitation process or a performance process. And it becomes much less time-driven, and it becomes much more competence-driven, where if someone meets a competence, you can then shift them up to the next level of that safe-to-fail experiment or that checkpoint. And I think that the better, if people do use protocols and say injury, return from injury and things like that, the better ones use checkpoint systems. If you can meet this task capability and you're competent, you can go to this next level.
Correct.
If you can't, you stay there or you go back. And what you're doing is running safe to fail experiments to see, can you do that? Cool, you can, move up. Move up. No, you can't, go back or stay there.
And I'm about to say, like, if you are someone who wants to use protocols, that's okay, but are you seeing the response that you want?
Yes.
Is there an appropriate stress to see adequate adaptation, or is it potentially neutral because it's not appropriate, or is it potentially maladaptation? Because that's the other issue I think you run into too.
And the maladaptation stuff is interesting because if you think about it, say from even a hormetic process, I don't know if we've spoken about this before, but typically in a hormetic process, people would have seen the general stress response or general adaptation syndrome. That was described by Hans Selye in the 1920s, and there's a lot of discussion about how that's not necessarily exactly how everyone does it, and it was theoretical and all these kind of things. But I think at least for people's ideas on how to represent this, what happens is you apply stress, the typical first response that you get, right, is negative. It might be fatigue, it might be soreness, it might be a reduction in performance.
Even like emotionally feeling drained, it can be lots of things.
The next thing that will happen if you allow adequate time for adaptation is you should see an elevation of that task's performance, right? And then the idea is if you do that to the right level, you'll get a super compensation, and that person's now level to deal with that stressor will be enhanced. Doesn't always work like that, as we know, and obviously that's theoretical. But what that creates is a concept where we know we should be expecting certain responses from the application of stress. So as you said before, like if you're applying something, you need to know what kind of response you should be aiming for.
Absolutely.
Do I want to see, okay, that was a big stimulus that I put in, and I want to see, okay, they're fatigued and they're sore? Because sometimes, for instance, and we actually spoke about this a lot not that long ago with some of our patients, where I said, if someone's coming in once a week and they're doing rehabilitation, and they're probably not doing anything else, you want to make that stimulus pretty decent.
Absolutely.
If you're going too gentle on that person, maybe you're not creating enough stimulus to see change over time. So sometimes, not that we're, maybe the patients criticize us, but sometimes they'll kind of almost complain about how hard their rehab is. And that's on purpose because we're trying to create a stimulus. And we know, okay, I know that you can only come in once a week, but I'm going to push you hard enough that I will see a response. And I know that maybe, if we check in with the person, which typically we do, halfway between, like, I was really sore for 2 or 3 days. And you're almost, in your mind, you're thinking, great.
Absolutely.
That was the response that I wanted.
Yes.
And then I know you've got 2 or 3 more days before you come back, and then I'll see you again and we'll reapply that stimulus. And hopefully, by the time you've recovered then, you're at a greater level than what you were the last session that we did.
Yes.
And that to me is starting to think about what responses you want to see. And I think as a coach, one of the things that I'm always messing with and always have this internal turmoil almost of is we do a certain amount of training or a certain block of training or even one session, whatever it is. What do I actually want to see from that? Do I want to see them be faster straight away?
Yeah.
Do I want to see that there's some degradation in performance? Do I want to and if they're not getting better over whatever time period you've set, then what you're doing is not correct.
Yeah.
Right? And you can't hide behind, again, theoretically my input was correct.
Or, this idea of this is what's been done in the past, let's do it again.
Yes. And I think, as I said, this starts to put together all of the pieces that we've mentioned. Identify what the task requires, identify what this person has, start to put together interventions that are appropriate for increasing the requirements that they need, run safe to fail experiments, and then consistently measure what you're doing. And you keep amplifying, dampening, or maintaining whatever those features are, and the way that you measure those is back against what they need to be able to complete.
Yes.
If you're doing that consistently, as I said, it's going to go back to rinse and repeat. And that, to us at least, is how you deal with a complex system, whether that's an injury problem or whether it's a performance problem.
Absolutely. Should we finish it up there, John?
I think that might sort of cover it. As always, this episode of Lateral Think is brought to you with the support of Strength by Numbers. Strength by Numbers have created an integrated clinical and sports performance system. The AXIT system uses force platforms, dynamometry and strain gauges to objectively measure everything from isolated movements to sports performance tasks. The system has greatly enhanced our clinical practice, decision-making and objectivity. We are no longer guessing. The greatest thing is its ease of use, both for practitioners and clients. There are no wires, no fixed setup, it's a fully integrated Bluetooth system. If this sounds like something that would enhance your practice, visit strengthbynumbers.com and tell them that Melbourne Athletic Development sent you.